my name is Allie. I'm the occupational therapy student working with you today. It's nice to meet you.
Nice to meet you too.
And remind me, what was your name again?
My name is Yvette.
Okay, well, Miss Yvette, what brings you into occupational therapy today?
Mainly for joint pain.
Okay, any previous diagnosis from like a doctor?
Yes, I was diagnosed with osteoporosis.
Osteoarthritis?
Arthritis.
Okay, I
yes,
just want to
sorry.
make sure. I'm just making sure we have the correct diagnosis in our notes
Yes.
as well. Okay, so you said pain. So for therapy today, we can do something called low laser light therapy. There's a lot of benefits from it, and the purpose of this type of laser therapy, low level laser therapy, it helps reduce inflammation, which will be really big for somebody like you who deals with arthritis pain.
Okay.
It improves circulation, it can enhance tissue repair and promote healing as well. Is there any like precautions or contraindications I need to know about beforehand?
Not that I know of. What do you mean by contraindication?
So like any recent history with like cancer diagnosis or have you received any kind of radiotherapy within the last 4 to 6 months?
No.
Okay, perfect. Then I think we are safe to go ahead and use this kind of therapy treatment today. So let me go ahead and sit down and I'll kind of go over it with you. So because this is technically a laser, we do have to wear some protective equipment. It's just laser safety glasses for us.
Is it painful or anything?
No, so it should be relatively painless. There shouldn't be any pain.
Okay.
You may feel like a little bit of heat. If it gets too uncomfortable, let me know and
Okay.
we'll stop. Because I don't want you to be in pain.
Okay.
Make sure you wear these glasses the entire time that we have the laser on and we're working with it. Make sure you don't look directly at the beam.
Okay.
Or any kind of like reflection of it, just to protect yourself. The glasses will keep you protected, but it's just an extra precaution we want to take.
Okay.
All right. So I'm going to go ahead and put on my glasses with you. And this treatment should be about 10 minutes long, just because that's kind of roughly the time frame for the laser therapy. Remind me, was this in your wrist that you were having pain mostly?
Yes.
Okay, perfect. So then let me go ahead and set this timer. And is it both wrists, just one?
Both.
Both? Okay. So we're gonna go ahead and probably just split it like 5 minutes and 5 minutes between both.
Okay.
So if you'll go ahead and give me, we'll start with
Take off
this.
my watch or anything?
Yeah, we'll probably need to take off your
Okay.
watch just so that I can access the area that's bothering you the most. So I'll start with your left hand here. We're just going to keep it laid out on the table like this. This is my laser. So I'm going to have the wand and I'm just going to do like slow sweeping motion along your arm, along your wrist I should say, while applying the laser. Like I said, if it gets too hot or it gets uncomfortable or anything feels wrong, just let me know and we'll stop.
Okay. Thank you.
Yeah. Okay. Is that okay so
Yes,
far?
that's good.
Have you ever heard of anything like this or done something like this before?
No, never. I've heard of it, but never had it done.
Gotcha. Yeah, this is a pretty newer thing that I learned about in school, so it's pretty interesting. I've heard good things. I've seen it work pretty well for patients with arthritis and help with their joint mobility, joint pain, stuff like that. So
Good to know.
I
Hopefully
hope
it will
that
help.
this is I really
Yes.
hope this is a good option for you and you're a good candidate for it.
Thank you.
I hear your cat.
Yes. She likes to be a part of everything. She's a nosy cat.
Aren't they all?
Yes. She's very silly.
She's very vocal.
Oh, yes. She likes to get everybody's attention.
Like she's the center of attention,
Yes.
life of the party.
Mm-hmm.
Still doing okay? No
Yes.
issues, no pain?
No pain at all. I
Okay.
can feel a little warmth, but it doesn't feel bad. It feels good.
Okay, perfect. Okay, so I'm gonna go ahead and rotate your
Okay.
arm so we can get the bottom side of your wrist. And I'm just gonna keep doing those sweeping motions.
Okay.
And like I said, if anything starts to feel uncomfortable, just let me know.
Okay.
How long have y'all had y'all's cat?
She's a COVID cat, so since 2019.
Wow.
Mm-hmm.
She looks good for,
Come on.
that puts her at what, like 5 years old?
Yes. Oh, yeah, this year.
Yeah. She's cute.
Thank you. She wants attention. She's a diva.
I see you moving your fingers.
Mhm.
You starting to feel a little bit of relief, maybe?
Yeah, it feels good.
Okay,
It
good.
feels not as tight.
That's good. That's what we want. We want it to start feeling looser and make it feel more comfortable.
So you said you're a student.
Yes, I am a student currently working to get my associates to be a certified occupational therapist assistant.
Good for you.
Thank you. Yeah, it's exciting. It's a lot of fun. I really enjoy it. It can be challenging at times. The course load's definitely a lot, but it's fun. I enjoy it.
I'm sure you'll do good.
All right, so it looks like we are about time to switch hands. So I'm gonna go ahead and turn this laser off, and then I'm gonna reposition you here, and we'll start on this arm. Do you have any experience with previous experience coming to occupational therapy or anything like that?
Yes.
Yeah,
Mm-hmm.
that's good. I feel like a lot of people don't know who we are or what we do. A lot of people are like, oh, so like PT, and I'm like, well,
It's so you're gonna get me a job, right?
well, yeah, that's the other common one. You can help me get a job. And I'm like, different kind of occupation. Think about going back to work. It's always fun to educate them though and let them know, because once they kind of understand what we do, then they're like, oh, that's really
A
neat.
better understanding of it.
Yeah.
Mm-hmm.
How's this arm doing?
It's doing
Doing
good. Yes.
Perfect.
This one's not as painful as my
As the
right.
other hand?
Mm-hmm.
Okay. I'll be sure to note that in my notes so we can keep track of that throughout each session.
Okay. And how often do y'all recommend to do this?
So it depends on what the OTR and your doctor, what your doctor's note says, and what the OTR feels is necessary, based off your like entry eval that they did. So
Okay.
off the top of my head, I can't remember what your OTR wrote in her email, but I'll double check.
Okay.
That way we can make sure we get you scheduled accordingly.
Okay, thank you.
Yeah, no problem. All right, looks like we're about halfway, so we're gonna go ahead and rotate your wrist again, and then we'll start on this side. So besides having a cat at home, do you have any other pets, or do you have a family?
Yes, I have 3 kids, 2 girls and a boy,
Oh, wow.
and we have my girls both have lots of animals.
Nice. So you have
Dogs and cats, my fur babies.
fur grandbabies.
Yes. And we're expecting our first grandson soon.
Wow, that's exciting.
Very exciting.
Well, congrats to you guys
Thank
getting a promotion.
So we're very excited and can't wait.
I bet. The baby's gonna be super spoiled. You said
Oh,
first
yes,
grandson or
yes.
first grandchild?
First grandchild, first grandson.
Oh man, the baby's gonna have it all.
He's gonna be spoiled rotten.
Still doing okay?
Still doing good.
Okay, perfect. You said your kids have a lot of pets.
Yes.
What kind of pets do they have?
Both my daughters have dogs and cats. one daughter has 2 dogs and 1 cat, and the other one has 1 dog and 2 cats.
Oh, so they like flip flopped.
Yes,
They
my other
like
daughter,
that.
my daughter used to have 2 dogs, but one of our dogs had cancer, so
Oh, that's unfortunate.
yes.
Well, I'm sure that they have big hearts, because that you have to have big hearts to love
Oh yes.
animals that much to have that many in your house.
Yes. Oh yeah, and I forget, one even had has a lizard, had an axolotl, and one time she even had some fish.
Wow, so she had a zoo.
Yes.
I think I'd get along with her. I like animals. That's pretty cool.
Yes.
You'll have to see if your daughter can send you pictures. So the next time we meet, you can show me what you said was an axolotl.
Axolotl.
Yeah,
Yes.
that's really cool. I've never seen somebody have one of those.
Yes. My son had one too, but unfortunately his died.
Oh.
It was my fault.
Oh no.
By accident.
Oh no. Well, those things happen.
It happens. Oh yeah, and he had a fish too that recently died that we had forever. It
Oh
was
my
a
gosh.
beta fish.
Oh wow.
Yes, it lasted 4 years, 5 years, longer
Wow.
than
That's long
we
for a
expected.
beta. Yeah.
Yes.
All right, and it looks like we are done.
Good.
All right, how do you feel?
Feels good.
Yeah.
Feels good. Yes. Like I said, this one doesn't have. It's not as painful as my
We
right.
can go ahead and take
But
this
I
off
guess.
and see.
Thank you.
Yeah.
I guess because I'm right-handed, I use this one more. So I'm assuming that's why my eyes are adjusting.
Yeah, they're dark glasses.
Yes. So I think that's probably why the arthritis hurts more on this hand.
Okay, well, great. I'm glad that it feels like it's helping you even already just within a few minutes of using it. We'll get you scheduled for your next session, and we'll keep using it, and hopefully we'll see some big progress for you with it.
Good. Yes. Thank you very much
Yeah,
for
it was
everything.
nice to meet
It
you,
was
and
nice
I
to
will
meet
hopefully
you.
see you next time.
Okay. Thank you.
Let me come wash my